But I want to ask you guys, I'm going to start with you, Joe and Angie. At this point, you have established, you have trained several of your staff, and you very soon will be board certified in clinical electrodiagnosis. But tell me a little bit about your plans for expansion utilizing diagnostics. What do you think will be your phase 2, your next plan on expanding diagnosis and utilizing both in-house and outside business models to further expand the practice?
Yeah, so our goals for 2020, and despite COVID and all the things we have going on, we're moving forwards. Our goal was to have at least 3 providers fully doing EMG and MSK services within our brick and mortar within our clinic. That's expanding from just Joe doing it alone. So, that's 3 times the providers. And then additionally, we are working on our outside, as Dimi had mentioned there, some of our outside work. And our goal is to have 2 of those set up by the end of this year. And Joe, you can go into a little bit more detail on what that entails.
Yeah, so our outside referral, and I have our outside business, actually, we have some really good reception in the community. It's just a matter of putting together all the little pieces of it. But I have between orthopedics and podiatry groups that are very well receptive and want to bring this into their practice. Actually, talking with them, it's another added revenue stream for them. It's another bucket for them. Kind of like we want to bring in more buckets. So you never just want to have just one bucket of just physical therapy. We have physical therapy, we have diagnostics. For us, we have athletic performance. For them, if they have just podiatry, now they can bring in, this added bucket. So we actually can do that. And what it's actually done, even just for me to start communicating, it's already bringing in referrals, not just for diagnostic, but it's also bringing in more referrals for PT. So just bringing that little communication piece in is already bringing up. But I can't even imagine once we get to actually get them as official signed in contracts. So it's very exciting.
Awesome. Thank you. And Bart, I'm going to ask you the same question. How are you planning to expand your business with the use of diagnostics in the months to come, both as an in-house and as an outside business?
You bet. So we kind of have a similar plan in that we want to have at each of our 4 clinics at least 2 providers that are competent in ultrasound. I think that's really critical. Especially because doing outpatient orthopedics, there's nothing that complements that practice better on a normal everyday basis than musculoskeletal ultrasound. And then by August, we hope to have our second EMG provider started with our practice. We have an individual that has had some background in EMG as a PT, some exposure that way, and sought us out. And has been trying to get a job with us because of that aspect of our practice. And so we're hoping to have all our ducks in a row to be able to bring him in and start that process through HOT. We also, our patient care coordinator has started a campaign where we just have some letters that we're starting with some physicians to be able to do some things with podiatry as well as orthopedists. And our hope is to be able to expand that in-house practice in with physicians, out of house for us, obviously, but in their offices to the point in which we can reach out to some of our smaller communities, start with diagnostics there, and then, of course, grow it to a PT practice because it's established those relationships for referral. That is really the groundwork that's necessary to start another practice and help our PT practices grow.
Thank you.